Hello, thank you, Sylvia, and good afternoon, everyone. Good morning to those on the West Coast. And thank you for joining us for our presentation today, Ag Worker Health 102, Supporting Agricultural Worker Health During the COVID-19 Pandemic. And this is a presentation of the Farmworker Health Network. We typically provide Ag Worker Health 102 at the National Conference on Agricultural Worker Health. But due to the pandemic, we are doing it as a webinar, and we are happy you're able to join us, or if you're listening to the recording, we're happy that you're able to listen to the recording. So the Farmworker Health Network is comprised of 6 national organizations, and we'll talk more later in the presentation about who each of our organizations are and the type of training and technical assistance that we provide. But all of us receive funding from the Bureau of Primary Health Care to provide training and technical assistance to health centers that serve agricultural workers and their families. The 6 organizations are Farmworker Justice, Health Outreach Partners, MHP Salud, MCN, the National Association of Community Health Centers, and National Center for Farmworker Health. Today, we will be talking about the federal protections for ag workers, as well as the health risks and challenges specific to ag workers during COVID-19. We will then talk about some healthcare and service delivery challenges and innovative practices that health centers have put into place to serve farm workers. And then we'll talk about who we are, who the Farmworker Health Network is. If we have representatives from the different organizations who will share the resources that they provide, training and technical assistance they provide. And then we'll also talk about the other national cooperative agreements who also receive funding from the Bureau of Primary Health Care to provide training and technical assistance to health centers. So we wanted to start off this presentation with a discussion about what are the protections in place for farm workers, for agricultural workers. And I'll be using farm workers and agricultural workers interchangeably throughout this presentation. So we wanted to provide that background. So as we talk about specifically when talking about COVID-19, and the impacts it's had on farm workers and how farm workers may be vulnerable to COVID-19, it's important to understand what are the protections in place. And specifically, we want to talk about the occupational safety and health protections and then the health and labor protections. So generally, there are a number of protections in place that, that protect farm workers in various capacities, both mainly in their occupation. So the one I wanted to talk about first was the Field Sanitation Standard. The Field Sanitation Standard is from OSHA. It was put into place in 1987. And the Field Sanitation Standard, what it does is it requires potable drinking water, toilets, and hand washing facilities, as well as information on good hygiene practices on farms. It requires that there be 1 toilet and 1 hand washing facility for every 20 workers, and that these facilities are within a quarter mile of each worker. And we have more information about the Field Sanitation Standard on our website. Farmworker Justice and Clinicians Network put together a clinician's guide that you're able to access if you click on this hyperlink. There's also the Worker Protection Standard. This was issued by the Environmental Protection Agency in 1992 and then updated in 2015. The Worker Protection Standard requires employers to comply with minimum safety precautions when using pesticides. And it's really a standard to protect workers who work with pesticides, including pesticide handlers, so that they can minimize their risk and exposure to pesticides. We also have a clinician's guide on the Worker Protection Standard that is also available on our website that we developed with Migrant Clinicians Network. And then there are labor and health protections. And I highlight these again because when we think about the current situation with COVID-19, it's important to understand what are their rights in terms of health insurance, but also what are the basic labor protections for workers. So the Migrant Seasonal Agricultural Worker Protection Act, which was passed in 1983, provides basic labor protections for workers who work under labor contractors. This does not apply to H-2A workers, but it does, it's basically for workers who work with labor contractors. And these are really the only labor protections that workers really have. Workers' compensation, which is coverage for injuries or illnesses that occur during work or as a result of work. It's pretty spotty for agricultural workers. The coverage for workers really varies by state. Only 12 states and DC, the Virgin Islands, and Puerto Rico require full workers' compensation coverage for agricultural workers. In other states, the coverage for agricultural workers is either limited or optional. So depending on where you are, the agricultural workers may not be covered under workers' compensation. It's important to note that H-2A workers are required to be covered under workers' compensation. It's a requirement of the H-2A program. So all H-2A employers do have to provide workers' compensation to their H-2A workers, regardless of the state workers' compensation coverage for agricultural workers. Finally, the Affordable Care Act, which was passed and signed into law in 2010. The Affordable Care Act also includes Medicaid, because there was a Medicaid expansion under the Affordable Care Act, although not all of the states took up the expansion. But according to data from the National Cultural Workers Survey, which is a survey done by the U.S. Department of Labor, about 18% of workers were offered employer-provided health insurance. 47% of workers have some form of health insurance, and 44% of workers reported that a household received Medicaid. So Medicaid eligibility really depends on the state, but for the ACA, really anyone who is here who is lawfully present is eligible for coverage and for subsidies under the ACA marketplaces. You do have to show that you do not have an offer of employer coverage. So for workers offered employer health insurance, they are not eligible for subsidies in the Affordable Care Act marketplace. But many workers, more so than workers who are eligible for Medicaid, are eligible for ACA marketplace insurance. And as many of you know, because you've been involved in outreach and enrollment, agricultural workers and their family members, including H-2A workers, have been enrolling in marketplace insurance and have been qualifying for subsidies. So when we think about healthcare access, we know that health insurance is extremely important. So it's important to understand the opportunities and the eligibility of workers for various health insurance programs. Under the COVID-19, since the pandemic began, there have been several relief packages that have been passed by Congress. The one I want to focus on is the Families First Coronavirus Response Act, which included a requirement for paid sick and family leave. And it requires employers with fewer than 500 employees to provide up to 2 weeks of fully or partially paid sick leave and up to 10 weeks of family medical leave to care for a sick family member. And all workers, including H-2A workers who work for eligible employers, are eligible for paid sick and family leave. There are exemptions for employers with less than 50 employees, but those employers do have to request that exemption. There also have been put in place by some states guidance or rules specific to agricultural employers in order to ensure that workers have protections during the COVID-19 pandemic. There has been no federal rule to require protections for agricultural workers or other essential workers. However, in the absence of that, a couple of states, Oregon specifically and Washington, have either put in place or are putting in place rules in order to require protections in either in the fields or in the housing. In Washington, it's focused on housing, to require protections put in place for workers so that they are able to better protect themselves from COVID-19. Other states have put in place guidance. California, North Carolina, Pennsylvania, to name a few, have put in place and provided guidance to agricultural employers about how they can protect their workers during the pandemic. However, that guidance is not enforceable. It is just guidance. So we recommend that you go to your state website, Department of Health, Department of Labor. We have links on our COVID-19 page on our website to guidance provided by different states, so you can see kind of what exactly is in place for your state, guidance or rules for the agricultural employers. I know there's been a lot of questions about H-2A workers, so I just wanted to mention that H-2A workers are still arriving. Many of you, I'm sure, have seen H-2A workers arriving. Their visas are still being processed. We've been getting questions about quarantine. There is no requirement for H-2A workers to quarantine when they arrive in the United States. There also there's flexibility now for H-2A workers who are currently in the U.S. If they want to extend their visa, they have the opportunity to go to another H-2A employer. So that's what's in place for H-2A workers currently. And with that, I will stop before I move to the next section and see if there are any questions. Sylvia, are there any questions?
There aren't any at this time, Alexis. If you do have questions, feel free to enter those in the chat, or if you want to speak, I can unmute you. You want to raise your hand.
And if there are any questions, of course, you can always ask the questions later. It's not the only opportunity to ask questions, but I know it was a lot of information. So, but if you have any questions, please feel free to continue to put them into the chat box. In the meantime, there's a question: are workers tested for COVID when coming into the U.S.? My response would be, we've heard anecdotally that some workers are being tested, but there's no protocol, there's no requirement for workers to be tested. I certainly would be interested to hear from all of you if you're hearing of workers being tested when they come to your area. That would be really that'd be really interesting information and good information for us to have. So I encourage you to share in the chat box what your experiences have been with that. So I am going to now talk a little bit, as we focus on COVID-19, I am going to talk a little bit about the risks that make farm workers especially vulnerable during the COVID-19 pandemic. And for many of you, this will not be new information, but we did want to just reiterate and share so that everyone is aware and on the same page. So first, looking at the working conditions of farm workers. There are many reasons why farm workers are especially vulnerable to COVID-19. Farm work is not necessarily a job where you can be physically distanced. And in some fields, yes, it's much easier to maintain physical distancing, but with other crops, it's not as easy. And then of course, if you're working in a packing shed or doing other jobs, that physical distancing can be very challenging. We've heard that workers are not necessarily getting protective equipment. We know that there are numerous campaigns to get masks to farm workers, and that is obviously filling a void because the workers themselves are not being provided those masks, those gloves to protect themselves. On some farms, there is a sharing of tools, and of course, sharing tools can increase the likelihood that you may be, infecting others. It can increase the likelihood of infection. There also, despite the field sanitation standard, there tends to be inadequate access to hand washing stations. And even if they do comply with the field sanitation standard, as I mentioned, the requirement is that the hand washing station is within a quarter of a mile. But that could be a distance. And given the fact that there is recommendations to wash your hands for at least 20 seconds, to wash your hands frequently, it's very difficult for farm workers to walk a quarter mile to a hand washing station and come back and do that multiple times during a day. So that lack of access makes them more vulnerable. And then of course, transportation. Transportation is always a challenge, but especially if the workers are being transported together. We've heard that yes, some employers are putting in place these protections both in the fields but also in the transportation, but it's not universal. And part of the reason why there is no real universal protection for workers and why it really is dependent on the employer is because there are no, and where the employer is located is because there are no federal standards. And so the lack of federal standards means that there's no uniform requirement for employers to put in place protections for their workers. And then housing-related health risks. We all know that that workers tend to live in crowded and substandard conditions. Workers who live in employer-provided housing tend to have multiple people in a trailer or in a labor camp. But even for families, due to their low incomes, being able to afford housing can be challenging. And so, workers' families tend to live together. So that creates additional risks when it comes to shared bathroom and kitchen facilities. The crowdedness, especially some housing has inadequate ventilation, and one concern is separating, especially in employer-provided housing, separating the COVID-19 positive workers or the ill workers from the other workers, and what's taking place, and are there adequate facilities for these workers to be able to quarantine or isolate themselves. And of course, if they're not able to, that puts others at greater risk of contracting COVID-19. And then we all know that anyone can contract COVID-19, but if you have certain chronic conditions, you're at higher risk for complications. And these chronic conditions that tend to put someone at higher risk include many chronic conditions that we know farm workers already have. So diabetes, hypertension, cancer, asthma. All of these conditions are challenging because workers already have difficulty maintaining treatment due to a variety of reasons, and being able to access healthcare. But with COVID-19, they're a higher risk for complications. And without health insurance, without access to healthcare, it can be very challenging for them to get the treatment that they need if they do end up becoming ill with COVID-19. I just want to touch briefly about the other challenges. Food security is always a challenge, and I think especially during this time when so many people are unemployed, are seeking food access. I think food insecurity is just another challenge that farm workers have to overcome. The limited job security and fear of employer retaliation. We've heard anecdotally that workers are reluctant to take sick leave that they are eligible for, or to assert their rights, or are reluctant to get tested out of fear because they worry about what will happen if their employer finds out. They're worried about asserting their right to paid sick leave out of fear that they may lose their jobs, even though there are protections against that. So that's always a challenge, and especially when the relationship is so unique between employers and workers, and there's that power dynamic, it's especially challenging. There seems to be a lack of information about COVID-19. And I know that many health centers are doing all they can, and community-based organizations, to provide information about COVID-19 to workers. But we also understand that due to the pandemic, there has been a suspension or reduction of outreach programs. And many of us know that outreach, that in-person contact, is the most effective way to reach a farm worker and their family, and connect them to healthcare. So that's been a real challenge. I talked about the ability to isolate if they're exposed or infected by COVID-19. I talked about the inconsistent application, and again, the fact that due to a lack of federal protection standards, the worker and the protections put in place for that worker really depends on the employer and where the employer is located. So that's a real challenge when it comes to workers being able to be assured that any environment they go into as essential workers who are out there working, when many of us have the option to work from home, that they are able to protect themselves. Lack of childcare has been a challenge, especially with the school closings. Migrant Head Start, which I know some sites are reopening or plan to reopen, but there will be reduced capacity. That's having the ability for the workers to stay at home with their children is not always an option. Are the kids going out to the fields? Are they home? It's of course something that needs to be addressed. And then of course limited access to testing and treatment. I know that many health centers are doing testing. The vast majority of migrant health centers are providing testing. They're doing mobile testing, but there's still, just generally in the US, is not enough testing for everyone. But certainly in farm worker communities, that testing is even more limited. But then the question is, if they do get tested and test positive and need treatment, what does that treatment look like, especially since farm workers already are challenged to access healthcare generally. it's more challenging for them to access the treatment, especially if they have a severe case of COVID-19. And with that, I will pause for any additional questions. I see a couple questions in the chat. So Noemi, and I apologize if I butchered your name, asked, a lot of farm workers and the fear of obtaining any COVID-19 resources are testing. In our area, sorry, I just lost that question. 1 second. In our area, they are being told that if they test positive in quarantine, they will be terminated. Would antibody testing be more effective for workers who do not have symptoms? That is a really interesting question. I don't know the answer to that. I'd be curious to hear other people's thoughts on that question. But certainly, as you raise, and as I also discussed, that fear is real, and it's something that I think needs to be kept in mind. But we do want to encourage workers to get tested because it is important that they know if they are positive for COVID-19. And then there's another question: are most employers aware of complying with OSHA standards focused on hand washing stations, sanitation? So I guess this question is about employers complying with the OSHA field sanitation standards. Not really clear. We've heard, we have heard that workers don't necessarily have access to hand washing stations, and as many of you know, enforcing these regulations is very challenging. There typically is not enough enforcement, and it really kind of falls on the worker to file a complaint if there are violations, because there just aren't enough inspectors. And of course, workers may be reluctant to complain because they are fearful about retaliation. So I think some employers certainly are complying with OSHA field sanitation standards. Some employers are also putting in place protections for their workers and doing what they can to protect their workers from COVID-19. But that's not universal, and there are employers who are not putting in place those protections. So I really think it depends on the employer. And I'm just going to read Noemi's response real quickly. In our area, someone tests positive, and the employer finds out the entire produce in that crew is being dumped. As you mentioned, this has to do with not having enough information regarding the virus and its effects on produce. However, our clinic is working closely with different farm crews to bring education to the farms, as well as emergency food and cloth masks. So I think that just emphasizes the important role of health centers and community organizations to provide information and provide those supplies, provide masks and food and other needs to workers during the pandemic. So thank you for sharing that. And if there are no more questions, I will pause here, and I'm going to hand control over to my colleague, Sylvia Partida, who will continue the presentation.
Thank you, Alexis. I'm just waiting for my, okay. And Sylvia, will you let me know when my screen is showing?
Yes, it is showing.
Okay, thank you so much. Well, thank you to everyone for joining us this afternoon. And Alexis, that information was so important. I don't know that we have had many presentations thus far that go into the detail regarding the protections for agricultural workers and how that really has such an important role during this COVID pandemic. So very important information. What I would like to present to you during this section of the presentation is to look at how COVID-19 has been impacting healthcare and the delivery of healthcare to agricultural workers. And I know that there are many different organizations, health entities that provide healthcare services, but we focus on the community, the network of community and migrant health centers, knowing that they are the safety net for the agricultural worker community and are funded through the Bureau of Primary Health Care to provide services. So I know that there are folks on the presentation that are listening in that may be working with other organizations, and we'd love to hear also what your experiences are. So I want to start off first with talking a little bit about, and give me a minute here. Okay. Starting in April, the Bureau of Primary Health Care began surveying community health centers around their experiences with COVID, the impact that COVID is having on their operations, and also surveying their ability to test and some information about the challenges they are having with testing. So what I am sharing with you right now is results of the last survey that was done. Health centers are responding to this survey every 2 weeks, and NCFH has developed an infographic that compiles the information just from those health centers that are funded for migrant health. But you can find the results of the full survey of all health centers on the Bureau website, and I've put in a link in the presentation so that you can look up that information. So based on the last survey results, we know that, and again, this is only for those that responded because it's not a requirement to respond. So from this last survey, 127 of the 174 health centers that are funded for migrant health responded. So keep that in mind, that this is just from 127 health centers. And of those, 93% say that they have the capacity to test for COVID-19, and 62% are able to do drive-up COVID testing. Now, one thing that we are asking, and I don't know that they will add it to this survey, but certainly important for the agricultural worker community, is how many of those health centers have the capacity to do mobile testing. So we have heard from several health centers around the country that they want to be able to provide testing out in the fields or out in, during going to the labor housing camps or working with employers to do testing. But there are some limitations, as Alexis mentioned, in regards to the availability of testing. So it would be interesting to have a better understanding of how many health centers have the capacity to do mobile testing. We know that many have mobile vans and have provided healthcare services and outreach services to the agricultural worker community using those mobile vans, but we haven't heard yet of very many that are doing some mobile testing, although some I know are. And then if you look at the next point, in the past, again, the question is in the last week. So in the last week, these health centers reported that they tested 17,764 patients. And of those, almost 4,000, 3,968 were positive. Now, if you do the math, you'll see that this is a 22% positive rate, which is much higher than in the general public, which I have found to be very interesting. But in general, if you look at the survey from the health centers, they are seeing a much higher positive rate. than what you see reported, for example, in your own city or in your own county. So not sure why that is, but we continue to track that and feel like it's an important piece of information that we should look into and see why it is that health centers, the patients that are being tested at health centers have a much higher positive rate. 48% of health center visits are now being conducted virtually, and I'm going to talk a little bit about that and how health centers have pivoted to that. 55% average weekly patient visits compared to pre-COVID. Again, the COVID pandemic has greatly impacted the services that are provided by health center service sites. And we'll talk a little bit about how that has impacted just staffing at health centers and the way they've had to change in regards to their operations. So far, and again, this is in the last week, these health centers are reporting 213 of their health center sites being closed due to the pandemic. Now, these are not grantees, but these are their service delivery sites. Still a great deal, and again, that changes for every survey. 16% of migrant health center staff on average are unable to work, and 20% have reported that they lack sufficient amount of PPE for the next week. So now let's look at how the COVID-19 has impacted health centers. And I feel like, you know, I'm preaching to the choir, because the information that we're sharing today is information that has been shared with us by many of our health center partners, and also gained from the survey results that I just shared with you. And so again, we're very interested to hear about your own experiences. But we know that, you know, I think what's been very interesting to me is those individuals that are not familiar with healthcare delivery or understand the impact that COVID has had on health centers, they're very surprised when they hear that people are being furloughed, or that they've had to reduce staff, or that they've had to reduce their hours. They say, this is a healthcare emergency. Why is it that a health center facility is having challenges during this time? Well, because the types of services that a health center provides on a regular basis, on a normal routine basis, some of those have been reduced. So just like we've heard, you may have heard in your own community, you can't go to the dentist, your optometry visit has been canceled, wellness visit has been canceled. All of those types of visits have been reduced or absolutely eliminated at health centers. Now that the country is slowly getting back to more normal activity, or we're trying to open up several different activities across multiple states, some health centers are beginning to slowly increase or make available those types of visits. But the impact has been that there's been a true reduction in the productivity and in the revenue that comes into a health center. And so that has led to some closures, and certainly to a decrease in staff. Again, some health centers have reduced the amount of the time from, you know, perhaps from full-time to part-time for some certain staff members. Others have had to put into place some furloughs. And a big issue, and you hear it all the time, and we continue to hear it from health centers, is that there's a lack of proper equipment and supplies, a lack of PPE. And so as health centers begin to think about offering these services again, they're challenged because they do not have sufficient PPE in order to do that safely. So that continues to be a problem. And although health centers have received funds from the Bureau of Primary Health Care to support some of these efforts, the problem with PPE is there is not enough supply in the US. So many vendors are having to get supplies from China, Mexico, or other countries, and those are on back order. So this is a real problem, and it will continue to impact health centers for months to come. The other challenge is technology. So again, we've seen a huge pivot that health centers have had to make so that they continue to provide healthcare services to their patient populations. And one of those has been to ramp up telehealth services. Well, not all health centers were adequately equipped to be able to do that in regards to technology. And then it's not just the health center, but it is the patient. Does the patient have adequate technology to be able to engage in that type of service? So again, looking at challenges regarding the platforms for telehealth, the equipment needs, and then even if you have all that in place, do you have internet connectivity? And when we think about the needs of agricultural workers and where they are in rural communities, we have to ask ourselves again whether they're going to be able to engage in that, given some of the limitations we know about broadband width and connectivity. And then for health centers, even though this is a viable and an effective way of providing services during this time, the problem is that reimbursement is not the same. And so there are a lot of issues right now regarding telehealth reimbursement. When we think about supplies as well, not only are we looking at shortages in PPE, but we're also seeing shortages of COVID testing supplies. And this varies across the country. There are some states and some health centers that say they have recently received a lot of supply and are able to do more testing, whereas there are other states and health centers within those states that say most of those supplies are going to county or to hospital systems, and the health center is not in that supply chain. So again, a lot of variation in regards to what's available for testing supplies. And then of course, health centers are challenged with how do they effectively conduct outreach efforts, and how are the enabling services that agricultural workers sometimes require, how are those able to continue to be deployed during this time? Well, I think that it is no surprise that health centers and the health center network has risen to the challenge. They are very innovative. They have been extremely flexible. They've been adapting their procedures, their processes, their operations in order to address the COVID pandemic. So I want to share with you some of the innovation that we have seen within health centers, and also talk about some of the resources that health center sites as well as partners, so example, the primary care associations that they work with and other organizations have been sharing a multitude of resources. And what I have found so compelling is that during this time, this network that is of the community health centers is a network that comes together to share promising practices, and they strengthen each other through that sharing. And so we applaud that, and we are here to try and support those efforts by bringing information that we have learned from health centers through this presentation, as well as through, like Alexis has mentioned, we have been trying to identify different resources, and you will find those in the websites of various resources that we'll talk about later on in this presentation. So first, let's talk about how health centers have really adapted to the need for triage. And so when we think about service delivery, they have had to very quickly develop a plan for how the workflow is going to happen. And so they have worked to develop some triage and screening services. Many have developed workflow, have developed some very specific scripts for their staff to use, not only for patients coming in, but also for community members and for people that are calling to ask about different services that are available at the health center. And of course, health centers have been very quick to provide staff training to all of their staff around how they should be responding to these inquiries. Some health centers have decided to have a dedicated COVID site. So instead of having it's focusing those efforts, whether it's testing or whether it's doing some screening, they have decided to use one of their sites for that and limit the exposure of the rest of their personnel. Some have started a call center, or they've used their call center. Many already have call centers. So they've used their call center for screening. So they use that for the initial screening and then are able to direct the patient based, again, every state and every community is a little bit different. Some health centers right now are able to test patients that are asymptomatic. Other health centers still have very strict guidance in regards to who can be screened. So the call center is being used to do some screening. Some health centers are doing screening immediately at the entrance for both staff and patients. So that may be temperature checks, and it may be 2 to 3 questions to inquire about their exposure and if they have any symptoms. Health centers that have not done, or even those that do have a dedicated COVID site, they've really looked carefully at the layout of the waiting area. So if they are seeing patients, they're having to look carefully at providing the ability to social distance amongst the patients that are being seen. Some of them are having patients wait in their car. So much like you do curbside service at a restaurant, you go, you wait in your car, somebody comes out and tells you it's your time to come in for your appointment. So a lot of innovation in the way health centers are dealing with this. And what I want to share with you, and I'm going to pause my screen for just a quick second here. And if I do this right, I would like to share with you, and once you know it, it's not working. I'd like to share with you it's a playbook that is, okay, hold on just a minute. Okay. I apologize here. My computer is not wanting to, okay. So the Wisconsin Primary Care Association and the Wisconsin Family Health La Clinica have provided some really amazing, some really great resources. And I am going to share one of those with you right now. Sylvia, can you see my screen?
Yes, looks good, Sylvia.
Okay, thank you. I'm so sorry about that. It took me a little while. So they have provided this great, it's called the MSAW Playbook, and it provides a workflow, and then it goes into some things to consider pre-arrival. So and this is pre-arrival, for example, if you are identifying both pre-arrival to your health center, and it gives as well as housing units, for example, if you're working with farm workers out in their facilities. goes to arrival visit, gives you information, scripts that you can use, has some educational materials that you can utilize, and then goes into some testing needs. So what do you need? So it really is, and here's something around the testing process. So again, a really good resource from our colleagues at the Wisconsin Family Health La Clínica. So kudos to them for sharing this with us and offering it so that others can also use it during as they prepare their health center sites. And if you give me just a minute here, I'm going to go back to my presentation. Okay, Sylvia, is my PowerPoint back on?
Yes, looks good.
Okay, thank you so much. So let's look at some other things that health centers are doing. We've talked about how they've really pivoted to telehealth, and again, health centers were had a really at a broad continuum of how they were doing their telehealth services. Some had already been doing quite a bit of telehealth services. Others are just beginning and have had to do that and ramp it up very, very quickly. So because some of the health centers have been ramping up, they have had to look at what are their equipment needs, looking at their protocols, their policies, ensuring that their staff have training. Some of them have had to redirect their funding in order to support the telehealth services. They've also had to look at what is the patient readiness. So think about, you and I may have, even at this point in time, I have yet to experience a telehealth visit personally. So what is it that I need to know as a patient about my own readiness? So if you're at a health center, if you are a provider and you're thinking about having to provide telehealth services to a patient, you have to begin to think about and assess, do they have a phone? Do they have a computer tablet? What is their internet connectivity? What kind of data or call plan do they have? Is there some training that we could provide patients so they can engage in this type of healthcare visit? So health centers have done a lot of different types of readiness and preparedness for this. Some of them have been doing some very formal assessments of their patients. Others have been doing it on the fly because there's been a need to do that very quickly. Others have looked at how they can cohort patients. So for example, understanding which patients are ready to engage in that type of service versus those that are not. So they have looked at how they can cohort patients based on the technology capabilities that they have. And I skipped, but I think that it's important to note also that some health centers have also done a lot regarding curbside service and providing, for example, delivery of pharmacy or curbside delivery for pharmacy. So they've had to make some modifications, especially right now when social distancing is such an important part of our lives. And one thing that we see and have heard very frequently is that mental health issues and ensuring that we are integrating behavioral health into every single health visit. And it could be the telehealth visit, it could be a telephonic visit or a personal visit, that the need for mental health support is very important. And again, looking to see what are the resources that health centers have available to them to ensure that they are meeting the needs for continued mental health support. So then when we think about what health centers are doing, and we've talked a little bit about this, so I want to just mention to you some important resources. But again, when you think about the COVID testing for your health center, many health centers are developing very specific protocol, scripting, standardized communications. We talked about the dedicated site. And Alexis mentioned is it's not only the protocols for the testing, but also being very precise on what the protocol will be if you do have a patient who has tested positive. So do you need to make a referral? What type of remote monitoring are you going to be doing? How much follow-up? So some health centers are following up with those patients every 2 days, but thinking also about the social support for that patient, and do you need to make referrals? And of course, as I mentioned, mental health. In particular, when we think about agricultural workers, and especially those that are either H-2A workers or workers that are mobile, that are migratory workers, is that they do not have their social support systems in that community. And if they have to be hospitalized, if they need additional support, what guidance and what do you have in place to provide that guidance for them, or that follow-up that they're going to need? So there's, again, the Wisconsin Primary Healthcare Association. They have a really great resource. It's called the COVID-19 Testing Toolkit. You see the link there on your slide. I encourage you to go, and if you do not have a protocol, this is a wonderful resource for you to look at, and you can modify. And they have, again, been very kind to share that with all their colleagues. Some health centers are being asked to take the lead in contact tracing. And again, there's a really good resource that you can use. It comes from the Association of State and Territorial Health Officials. And we've provided the link there for you as well. So health centers have also looked at how they can provide information to their patients and to agricultural worker communities. And so many of them have come up with informational flyers that are customized to their own health center, which is really important. You want to make sure that the information you're providing has specific information about your health center's capacity to either screen or test or make a referral, what types of services are currently available, and also have that information that is available that your staff can provide verbally, because there are a lot of precautions that we are having right now, especially with the social distancing, that sometimes the best way to provide information is via telephone or partnering with Spanish language radio or some other organizations that are providing this type of communication that can be done in the community. So think about, what are your media talking points? Really utilize your media to help you with those messaging. Think about a press release that you can do. And many of us are relying on social media right now. So think about what you can do to provide that messaging via social media. And if you have the time and are able to do informational videos, that will help to provide that education to community members. We talked a little bit, Alexis mentioned how some of the outreach efforts have either been impacted. And so some of the health centers have been very proactive in wanting to continue to do their outreach, but they have modified their procedures. So they are training their outreach personnel to continue to do outreach, but to stay indoors. So where you may have gone inside into different areas, now the outreach is being conducted outdoors to maintain social distancing. Of course, PPE is very important. Many health centers are using telephonic outreach. Others are partnering with other community members to do like a resource drop-off. Some of them have been providing cleaning supplies or kits that they can distribute within the farm worker communities with those messagings and with the important messages around either social distancing or hand sanitizing. So all of these are different ways that health centers have shown a lot of innovation. And we talked about how working with employers is very important. If you did not already have a relationship with an ag employer, there's some good resources that are available to help you with some guidance. Alexis talked about there are some recommendations that states are providing that can be shared with employers. I also have, there are some that you can find on websites. For example, this is one that is the agricultural worksite checklist. Again, this is a way that you can engage with a local employer in order to help their employees and also to support the efforts in regards to keeping farm workers safe. And that concludes my section of the presentation, and we will stop there for any questions.
Okay. We do have one comment that Rachel has made stating if the health center is considering providing contact tracking, it is critical to check on FTCA coverage and or gap liability coverage. It is recommended your CEO contact the project officer to clarify. And if anyone has any questions, please enter them in the chat box at this time. Or if you would like to speak, raise your hand and I can unmute you. Okay, I don't see any questions coming in through the chat at this time.
Okay, so we'll go on to the next section, and Alexis will begin with some resources for training and technical assistance.
Fantastic. Thank you again, Sylvia. We have talked about what health centers are doing, the challenges that farm workers face. But now we want to switch gears a bit and talk about the training and technical assistance that's available to you from the Farmworker Health Network as well as from the other national cooperative agreements. So first we're going to focus on the Farmworker Health Network. Again, there are 6 of us, and our websites are on the PowerPoint. We actually have representatives from the different organizations, so they'll be sharing about their organizations. I'm going to kick it off with Farm Worker Justice. So for those of you who may not be familiar with our organization, we are a national organization. We're based in Washington, D.C. Our mission is to improve the living and working conditions of farm workers and their families through immigration status, health, occupational safety, and access to justice. We're pretty multifaceted. We're based in DC, so we do policy advocacy, both with Congress and the administration. We also engage in litigation with legal services organizations across the country. We also do health promotion, coalition building, support union organizing, and training and technical assistance. As part of our national cooperative agreement, we focus on 2 areas, policy and community collaborations. And it's important to note, oftentimes there are questions about, why are there 6 Farmworker Health Network members? And the answer is that we work collaboratively together but we also have our own unique niche. So each of us will talk about the unique niche that we contribute as a national cooperative agreement. For farm worker justice, it's policy and community collaboration. So because we're based in DC and we have staff who focus on policy advocacy, we provide training and technical assistance on policy issues affecting agricultural worker health and access to health care. This includes health insurance, COVID-19, pesticide, occupational environmental health, so on and so forth. We also do a lot of work around community collaborations. We traditionally have very strong relationships with farm worker legal services organizations, with community-based organizations, and Migrant Seasonal Head Start. And so we try to promote, strengthen, engage partnerships between health centers and these organizations, because farm workers have different points of contact in the community, and through collaboration, we can ensure that farm workers are familiar with and accessing all the resources available to them. And in addition to partnering with employers when it comes to COVID-19, I also would like to emphasize partnering with legal services, especially for those workers who may not have access to hand washing stations under the field sanitation standard, or who may not be able to take sick leave if they do test positive for COVID-19. It's important to partner with legal services to help that farm worker assert his or her rights. So legal services is also an important partner in the community. We have a COVID-19 page on our website. This page has a lot of different resources, and these are resources that we have gotten from other organizations. We link to the other organizations' websites, and these are resources for both workers and farm worker serving organizations. We also have information about the different state guidance and rules that I mentioned earlier in the webinar. We also have policy recommendations that we've shared. We also have been doing this Facebook series called The State of Farm Workers in the COVID-19 Era, where we have invited different people, heads of farm worker organizations, members of Congress, and others to share information and discuss the impact that COVID-19 is having on farm workers. All of those videos are available on our Facebook page, and all of these resources and the information is available on our website.
Hi, good afternoon. My name is Cindy Selmy, and I'm from Health Outreach Partners. We are currently located in Oakland in the Bay Area of California. We started in 1970, and we started as a direct outreach provider on the East Coast, providing services to migrant farm workers and seasonal agricultural workers. This summer, we are celebrating our 50th anniversary. And as an organization, we recognize the important role of outreach and how outreach plays in improving the access to primary health care and other services that address the social needs of vulnerable populations, and how addressing those needs improves their health. Our mission at HOP is to build strong, effective, and sustainable grassroots health models by partnering with local community-based organizations across the country in order to improve the quality of life of low-income and vulnerable and underserved populations. But additionally, our vision is a country where all people are valued and have equal access to health care. And our work is really to address those issues such as health inequities, as well as racial and structural inequalities in our communities, with our vision being the guiding force in our work in order to break down those inequities. Next slide. As this slide shows all of our services, and as Alexis pointed out in her presentation on farm worker justice, each national collective agreement has their own niche, and ours is training and technical assistance around health inequities and issues affecting the social determinants of health. And some of our services that we provide, as you see here, is intensive and targeted consultation, on-site trainings, conference presentations, webinars, and various workshops. In this new environment, we have worked to pivot our services to include more virtual opportunities for health centers, some that are including podcasts, virtual conferences, and convenings. Some of the topics that are most requested include addressing transportation, which is one of the most common and impactful social determinants of health, working with organizations to conduct community needs assessments, facilitating workshops on structural competency and structural racism and how it shapes health outcomes. We also have a series of workshops on self-care and compassionate care for health workers. We are an active member of the Farmworker Health Network. We're currently collaborating, and as you see here, on the FHN's bi-weekly newsletter directed at COVID-19 resources that is mainly specific for agricultural workers and their families. Also, Health Outreach Partners is gathering COVID-19 resources for our local community and posting them regularly on Facebook, Instagram, and LinkedIn. So we invite you to log on to our website and check us out on those platforms. Thanks and have a great day.
Thank you. Good afternoon. This is Esli Reyes. I am a program director at MHP Salud. So I will go over a quick overview of who we are. We are a national nonprofit organization with over 35 years of experience in developing, implementing, and evaluating community-based and culturally tailored community health worker or CHW programs. We have offices in Texas, Washington, Florida, and Michigan states. And our mission is to promote the CHW profession nationally as a culturally appropriate strategy to improve health and to empower underserved Latino communities. And lastly, our overarching vision is that our populations and their community will enjoy health without barriers. Next slide, please. As I previously mentioned, we offer training and technical assistance or consultation services to federal qualified health centers, PCAs, and other healthcare organizations that wish to start or strengthen their current CHW programs. We offer these trainings via virtual methods and in person, and our audience usually consists of CHW supervisors, some health center leadership, and other professions working with CHWs. And our technical assistance that we provide, we cover topics such as the design, planning, evaluation, and other stages of the implementation of the community health worker program, as well as social determinants of health and any other health relevant topics. Next slide, please. To finalize, I would like to mention that we are constantly developing relevant resources, and today I just want to share with you some of our COVID-19 bilingual resources. The first one, CHWs and COVID-19, covers the CHW's response to help with the community challenges that are faced during this public health crisis. And the second one is an infographic providing visuals consistent with the CDC guidelines. Both of these resources are available in our website and are available in English and Spanish for download. And overall, I invite you to visit our website, our research portfolio, and our COVID section to obtain the latest information. You can also access many other CHW resources, guides, and connect with us in case you need any of our training or technical assistance services. Thank you and have a great day.
Hello, this is Sylvia Partida, and our colleagues from Migrant Clinicians Network couldn't join us today, so I'd like to share a little bit of information about Migrant Clinicians Network. And they've been around since 1984, and they provide bridge case management, mobile patient support, TA, professional development to clinicians, and work with health center service delivery sites to provide quality health care that increases access and reduces disparities. Next slide. So some of the projects or resources that I want to focus on are they provide clinical education, so education for clinicians, and many of these are available on their website. They also do live webinars and on-site training. They have lots of different, a comprehensive online database of downloadable resources, and they have included now information about COVID-19 that you can download. They also have and provide echo clinics, which are led by expert specialists, and they provide ongoing dialogue and case-based learning and peer-to-peer networking. Next slide. So a little bit of information, if you're not familiar with their health network, I encourage you to go to their website, go to the health network. They assist patients and the health centers and health entities that provide service to them to advance continuity of care and treatment. And they currently are working with over 12,000 patients are enrolled. And again, you can learn more about that on their website. They also they have a program called Witness to Witness, and it provides a standard of care to promote individual and organizational resilience for clinicians that work with vulnerable populations. And we are the National Center for Farmworker Health. And I just want to tell you, highlight a few things. We do have very specific resources for farm workers, agricultural workers, and family members. We also support health centers through governance, development, and training. We do offer services around program management, staff development, develop health education resources in English and Spanish. Next slide. Here's a sample of some of those resources. Again, I invite you to go to our website where you'll be able to find information about understanding the population that is primarily the ag worker population that we work with. We also emphasize health education materials and resources that are culturally appropriate. And we work very closely with health centers and their board, and especially the consumer board members. Next slide. We have a dedicated web page on our website around COVID-19, and you will find resources that are for agricultural workers, for employers, resources that are in various languages, as well as resources for health center and health center providers, and some of the top resources that we have found that are specific to the farm worker or agricultural worker community.
Buenas tardes, good afternoon. I'm Rachel Gonzalez Hansen, and I am with the National Association of Community Health Centers. So I would like to, first of all, start by dándole las gracias. Thank you all so much for the tireless work that you have been doing, especially over these last few months, and the sacrifices that you have made and your family's sacrifices as we continue the mission of the health center. So thank you for that. And I do want to speak a little bit about the National Association, and we'll call it NAC. NAC has been around for 49 years this year. It is a nonprofit national organization, and as you can see, our mission is to provide support in a lot of different ways for community health centers, community and migrant health centers, so that they can continue to provide the services to our patients. We are an advocacy organization as well, so we do represent almost 1,400 individual corporations that serve almost 28.5 million patients with doing those through the sites And there's a total of almost 12,000 service delivery sites across the country and in the territories. So it's a very broad network, as you can tell. Next slide, please. Thank you. So we do a myriad of different things, as you can see. Again, advocacy is a big piece of what we do. We want to make sure that health centers have the resources that they need, that have the protections that they need to be able to do the care that they provide to the centers. So we do a lot of work at the national level, a little bit at the state level, working with the PCAs as well. We do conduct a lot of research and analysis, trying to make sure that we have the documentation that we and the backup to prove the value of health centers to the healthcare system of the country, and not just about how much we save the system money, but more importantly, the healthcare outcomes. You know, our patients are healthier than those that are seen at the private sector, even though most of the time our patients are the ones that are not only the most vulnerable, but they are also the ones that are in poorer health. And so that's very important. We provide training, leadership development, a lot of technical assistance. Anything we do is to support and strengthen the health center governance and operations, because we truly believe in that model of care. We develop alliances and partnerships with not just the public sector, but with the private sector as well. We want to make sure that we are bringing resources from all ways, from all venues to the health center programs, so that they have what they need on the ground and in providing their care. They also do a lot of group purchasing. We have the VIP program where you're able to take advantage of the economies of scale and purchase medical supplies, dental supplies, equipment, and so on in a more cost-effective way and save money to the health centers themselves. And as I mentioned earlier, we work significantly with the state associations and the regional associations and the health center controlled networks, trying to ensure that we strengthen, again, the health centers, that our mission continues to expand and grow, that we're able to build the model that we have that has been so effective for over 55 years, as health centers history proves that, right? And we have one more slide, please. So we also have some COVID-19 specific resources. If you'll go to the NAC website, and on the very top of their first page, you will see at the top it says that there is a link to Health Center, the Health Center Resource Clearinghouse. You'll hear a little bit more about that later on in this presentation, but NAC does house and maintains that resource and the information that's in there, and it's very, very valuable. It has an array of resources for everything from COVID to operations to governance to regulations and so on and so on. So please take a few minutes to go through that if you're not aware of it. It's very, very helpful. If you do go to that website, you will also see on the right side, COVID-19 is in red, and if you'll click on that, you will go to specific information about COVID-19 and resources and updates and FAQs for health centers as they're trying to work through what they need. They also have another, we also have another resource called, it's on a NoodlePod format, and I know the name is really funny. I keep saying NoodlePad, but it's NoodlePad. And what I really like about that resource is that it's actually organized in a table of contents. And so it makes it very easy to find by topic what you want, what information you need to get to. So if you're interested in joining that, just because of the way that it is designed by the vendor, you have to be invited, but it's not meant as a way to keep you out of it. It's just the way that the format is set up. But if you will send an email to Susan Hansen, and you can see her email address there, you will be given an invite, and you'll be sent an invite, and anybody that's in the health center world is very welcome to join and participate in that. Again, gracias. Thank you so much for your work. Please stay safe. You're very important to all of us. Thank you.
So in our last few minutes, and thank you to our FHN partners for sharing information about your organizations, and we certainly hope that you go to their websites and check out all the great resources. I also quickly want to share information about the other national cooperative agreements. So there are 6 of us in the Farmworker Health Network, and then there are 14 other national organizations who receive funding from the Bureau of Primary Health Care to provide training and technical assistance to health centers. There are these national cooperative agreements, these national organizations who are specific to special and vulnerable populations, APCHO, Equitable Care for Elders, Corporation for Supportive Housing, and so on. We certainly encourage you to go to their websites. We also, there are NCAs, National Cooperative Agreements, national organizations who provide training and technical assistance specific to capacity development. And you'll see those NCAs here. And again, we encourage you to visit their websites and to get more information. If you want a one-stop shop, and Rachel mentioned the Health Center Resource Clearinghouse, if you don't want to go to every single website, you can actually go to the Health Center Resource Clearinghouse. The website is healthcenterinfo.org, and all of the national cooperative agreements have contributed resources to this clearinghouse. And you can go to this clearinghouse and access the websites and the resources from all of the different national organizations, as well as some primary care associations. And this is just one example of some of the information that's up on the clearinghouse. These are resources specific to COVID-19. And you'll also see in the clearinghouse that all of the partner COVID-19 pages also have links from the Health Center Clearinghouse. So instead of having to remember every single website for all 20 national cooperative agreements, you could just go to healthcenterinfo.org and you can find all of our information in that one website. So it's very convenient. Finally, of course, the Health Resources and Services Administration has a lot of information, including funding announcements, frequently asked questions, links to information about training and TA, data. So of course, we encourage you to go to the HRSA website, and they also have information specific to COVID-19. I know it is the end of our time, but if you have any questions, please feel free to put them into the chat. This is our contact information. If we were not able to answer any questions, please feel free to contact Sylvia or myself, and we will respond to your questions. We can also share any questions that you may have with our other partners, because we provide referrals across our different partners. Thank you again for participating in this webinar. We really appreciate your participation, and as Rachel said, really all the work that you're doing in your communities to ensure farm worker access to healthcare and to protect workers during the COVID-19 pandemic. And we know that you're on the front lines, so we thank you also for all that you're doing and sacrificing. So thank you, and with that, I will turn it back over to Sylvia for final words.